Welcome to our session on climate change, health, and innovation. We're really excited for this event to really bring this focus of the greatest health threat that we face, climate change, to the ViVE audience, to this health tech, health innovation audience. And so to get started, just going to share a few slides on why we should care about climate change from a healthcare perspective, where the different opportunities are, and then we'll get into our first panel. All right, so climate change is one of the greatest health threats that we face. There is a huge economic cost in terms of the dollar amounts that health systems, communities, individuals are going to be facing. And according to this new report from the World Economic Forum, going to be in the trillions of dollars for healthcare systems across the next few decades. And we're already starting to feel that. On the other hand, our healthcare systems are worsening climate change. The US healthcare system, if it was a country on its own, would be the 13th most polluting country. The US healthcare system creates 25% of global greenhouse gas emissions, despite only taking care of 4% of the world's population. So these are all interconnected forces. Climate change worsens the health of communities, of people, has impacts on healthcare systems. Healthcare systems then in turn are worsening climate change. And as we think about this from a healthcare technology innovation perspective, there are multiple avenues where we can start to act, to connect the dots, to connect people who are making change possible. And that's what we want to highlight for you today. I'm going to go over some additional background information, and then we'll be able to take a deeper dive into where those opportunities are. So just to give everyone the lay of the land, because I know this is not really a climate change conference, but all of you are probably familiar with the IPCC report. This is the annual report from scientists around the world where we have the consensus around climate change. And there are different facets to it, and increasingly the IPCC report and COP, the UN Conference of Parties that meets annually to discuss climate change, increasingly talking about the health effects. This December at COP28, it was the first time there was a health day where the global implications to the health of people, communities, health systems were addressed with a lot of specific focus. We are increasingly seeing medical journals from the Lancet to JAMA have special issues on climate and health. There are more organizations that are getting involved in this from the healthcare space. The Medical Societies Consortium on Climate and Health has put together all of the major medical organizations and collected a lot of great research and findings on what we understand about how climate change impacts people's health. Here are just a few articles and diagrams highlighting this. We know that there are impacts across every system, every biological system. We're starting to better elucidate a lot of unique mechanisms and paths. And there's things that are obvious, but we're also learning a lot of novel pathways as well. For example, there are now over 40 systematic reviews that connect poor air quality from wildfire smoke to poor outcomes in pregnancy. And as we start to uncover these pathways between how climate change impacts health and impacts healthcare delivery, we need to start to respond. We need to think about this in our care delivery, in our infrastructure, and technology and data can play a huge role in that. It's also really important to acknowledge that the cause of climate change and the impacts are huge health equity issues. From a global perspective, the nations that have polluted the most often feel less of the impacts compared to the nations that have polluted the least. And the diagram in the top right shows the global burden of climate change at a national, international level. But then even within the United States, we know that the impacts of climate change are being felt unequally. The article on the bottom that I highlighted here highlights how the racist practice of redlining, where neighborhoods, particularly black neighborhoods, in the past were not eligible for loans, are now today, as a result, the same neighborhoods where there's less tree cover and as a result, there is less protection from excess heat days. So because of the effects of past racist policies, we're now still feeling those health impacts today in a myriad of ways. But there is a lot of action that's happening and a lot of hope, and we're going to be talking about a lot of the initiatives that are ahead. And a lot of this has happened from grassroots advocacy, from Gen Z, from youth leaders who've really called for change, as well as indigenous communities around the world. There's also a lot of top-down regulation and action that's happening. The US government now has the Office of Climate Change and Health Equity. A lot of national healthcare organizations are starting to lead the way in showing how we need to mobilize our resources to address climate change and health. And we're also starting to see the private sector play an increasing role in decarbonization of healthcare systems, as well as starting to think about how we build the infrastructure to address the health impacts of climate change on people's health, on communities, and clinical care. I wanted to highlight this great report from Deloitte about the importance of climate resiliency for healthcare systems, and they point out what could be done from a perspective of both mitigation and adaptation. And these are two key phrases, two key words that I wanted to just highlight and mention that you'll hear throughout this afternoon. Mitigation is a process of decreasing the healthcare system's impact on climate change. Adaptation is preparing for those impacts of climate change. And there is a lot across both of these different areas that technology, informatics can play a role in. Wanted to just highlight the American Medical Informatics Association recently has started a climate health informatics work group to address some of these opportunities and areas. And that is also why we started CHILL. CHILL is the Climate Health Innovation and Learning Lab. CHILL started as a way to connect the dots between the health tech community, the climate and health community, and the climate tech communities, all individuals, groups that have been working on this problem from different angles and trying to help to catalyze this movement. We do work in advocacy and education, consulting, and helping to build solutions. And if you go to our website, you'll see our newsletters that talk about a range of topics. And this is our team that you'll see throughout the day. And with that, wanted to just introduce the first panel. We are going to be talking about climate health and innovation from a healthcare system, innovation and informatics perspective. That's going to be over the next 45 minutes. And then after that, we'll have a second panel, which is going to focus on the funding and building aspect of opportunities at the climate health and innovation intersection. And I just wanted to end this initial introduction with this quote from Kendra Pierre-Louis. We need different stories, ones that help us envision a present in which humans live in concert with our environment.
Alrighty. Thank you, Chethan. Hello, everyone. My name is Stefano Leitner. I am a San Francisco-based physician working in tech and one of the co-founders of CHILL. It's exciting to see all you here today to dive into the intersection of climate, health, and innovation. We have a really exciting first panel, the first panel called Health Systems on the Frontier of Climate Change Solutions. And I'm really privileged to have this really awesome group here today. So what I want to do and put context for our conversation here is I really want to understand how health systems think about the way that climate impacts health, what they're doing to address it, and what the role is of physicians, healthcare providers, policy, funding, innovation in all of this. And so to kick things off, I'm going to have you all introduce yourselves. We have a really stellar panel here today. So if you could all start by telling us a little bit about who you are, what you do, and how you found yourself at the intersection of climate and health. You start here, first one? Yeah, cool. Oh, you think you just go?
Great, thanks. Hi, everybody. Seema Wadhwa. I'm the Executive Director of Environmental Stewardship for Kaiser Permanente. I have been working at the intersection of climate, environment, and sustainability for the healthcare industry for about 15 years. I came to this industry as a civil engineer. I spent my first career designing roads and neighborhoods, and then really went on to try to find something more meaningful. And when I stumbled upon the relationship between our health and our environment, and really how how it wasn't totally understood, and the role and opportunity the healthcare sector had to drive change. It was a moment it's been a journey in which I continue to be inspired. So I'm excited to talk a little bit more about how we approach this at Kaiser Permanente. But I think the thing that I would highlight is that what I've really learned throughout this journey, and what I continue to be excited about, is the opportunity for people to understand the why this work matters, to really help them drive and connect change that they can bring to one of the greatest challenges of our times. Thanks.
Thank you.
My name is Bayless Beard. I'm the Director of Sustainability at Blue Shield of California. We're a not-for-profit health plan and one of the National Association of Blues. And I have a shorter period of time that I've been focusing on this. My background was in human rights and social entrepreneurship, and I spent about 10 years in DC building and then as director of a nonprofit crisis intervention and coordinated response agency, and became increasingly concerned as high heat days started to go up on the number of just increased crisis calls that we were getting, and was addressing that through our community health programs, and then decided to go back to an MBA and skill up, and then joined Blue Shield of California because of how excited I was to see their efforts in Health Reimagined and really systems transformation that they've been leading over the last 5 years. I've been there for 5 years, and also excited to talk more about our efforts in sustainability.
And my name again is Chetan Sarabu. I am a general pediatrician at Stanford. And prior to all of my healthcare education, I actually studied landscape architecture. And that was really the introduction for me of starting to understand the links between environmental health and human health, and has been a thread throughout my career. And then I think working in the San Francisco Bay Area throughout the past few years, taking care of children who are exposed to wildfire smoke, triggering their asthma, taking care of children in a primary care clinic setting that are anxious about the environment, really spurred me to think a lot more about what we could be doing about climate change from a systems level. And my work also as an informatician helped me to connect these dots that really led to the co-founding of CHILL, along with Stefano, with Betty and Katie, who you'll hear from a little bit later, really to look at what we can do with this really big challenge and opportunity ahead of us from the innovation health tech community. So excited to chat more about that this afternoon.
Didn't I tell you an amazing panel we have here? Well, guess what? You have the chance to ask them questions yourself. If we have enough time, we'll pass around a microphone for Q&A. We had allocated about 45 minutes for this whole thing. We're running a little short, but if there's time, we'll invite you in to join on the conversation. So to kick things off, I want to start by saying that, honestly, not long ago, I was not familiar with the roles of Director of Sustainability or Executive Director of Environmental Stewardship, especially at large healthcare organizations. And as many in the audience may not be familiar with that or understand it either, I'd like to dive in by demystifying what these mean. So my question is, really for you two first, is what roles do sustainability leaders play within large healthcare organizations? And how do you integrate sustainability into the strategic and operational priorities of a healthcare company?
Great. So, I agree that not too long ago, this really wasn't a role, and 15 years ago, there were not very many people doing this work. And so, it has been an opportunity to really build at the same time as solution solving. And the work that we do when it comes to environmental stewardship in a healthcare industry or for a healthcare system really falls into a few key categories for Kaiser Permanente. The first one is really understanding and managing our own sustainable operations. So a lot of people don't look at the healthcare industry in terms of its environmental impact, but we have large facilities. We're the second largest user of energy by industry. We have food services, transportation. We really run as small cities, and all of that creates negative impact. And the Hippocratic oath that we all live by in healthcare is to first do no harm. So we really are focused on what can we do to reduce the impact of our own footprint. But we go beyond that in appreciating that it's not just what we do within our four walls, it's how we support our community as a nonprofit. So some of the other work I focus on is addressing investments we can make in the community upstream that have a downstream impact on health, whether that is working with farm workers in Northern California and helping them develop resilience toolkits, or working at a national level with partners such as National Academy of Medicine and helping develop a climate and health research agenda. But then the next layer, the third thing that we really focus on as part of our strategy is how we're driving change more broadly. So how are we changing the sector and beyond the healthcare sector and really helping connect the relationship between climate and health. So for instance, we work closely with partners such as the World Economic Forum to build and bring these issues to a larger forum, a larger conversation piece, working with BSR, Business for Social Responsibility, in bringing together large Fortune 500 companies shoulder to shoulder with community-based organizations in solving and understanding what role in working together we have in addressing the relationship between climate change, health, and equity. And lastly, but I would say most importantly, appreciating and understanding how we can be there for our members. How can we look at the way in which we give care in those conversations that are happening in the medicines that we are prescribing? So, there's a lot of different elements to this role, which keeps the days very exciting.
So we have a similar structure in many ways. So we focus our work around the mitigation work. Blue Shield has been measuring our carbon footprint and looking at our emissions since 2018, and we're on the pathway. We've recently pledged to move away from our previous carbon neutral and carbon negative certification and actually commit to science-based targets for reductions, which is one of the kind of gold standards in addressing sustainability and focusing on our footprint, and enables us to broaden the areas of work beyond just our operations, but also our supply chain and our investment portfolio. We are also focused on adaptation as an area of our work, so we assess the risk that the climate crisis presents and triple planetary threats present to our members, our business, and the healthcare operations of the providers in our network. And so that's an area of kind of growing work that we do. And then we organize the third pillar of our work around climate leadership. And so this is efforts to try to advance thought and action leadership within the sector. So we've done things like a study that we published a couple of years ago on the impacts of the climate crisis on youth mental health, which found that 80% of youth in California are already reporting negative mental health impacts from vicarious exposure to climate health. And we know that the severity of the impacts for youth that are directly impacted by climate events is even more concerning. We also do research that we'll publish later this year around utilization impacts of climate events in California, and found both statistically significant and varying degrees of magnitude of impact of climate events between 2017 and 2019. So trying to advance work of helping build the business case for why, as payers, we should be looking at the effects of the climate crisis, and advancing the conversation around this. And we have done research just around how to incentivize healthcare delivery that's both climate resilient and decarbonized. And so we also did a study on virtual care a few years ago, conducted a life cycle assessment, found that in our virtual care pilots, there was a 25% reduction in carbon emissions and a 35% reduction in water use, and so that led to innovation work, including the launch of a virtual first health plan that advances hybrid care as both a climate resilient and more climate smart form of healthcare delivery.
Wow, thank you so much. I'd like to maybe dive in a little deeper with Seema, but before I want to mention and congratulate you for being awarded one of Time Magazine's 100 most influential climate leaders. So can we give her a little round of applause for her for such an amazing? Yeah. So as one of those honoraries, I think it's worth mentioning to everyone and like re-emphasizing how expansive your responsibilities are within Kaiser Permanente and how your role intersects so many sectors, including facilities and funding, purchasing, physician groups, and the list goes on. Really curious, so how you utilize your role to foster such systemic sustainability goals across so many sectors, and how that can actually be mirrored or copied by other healthcare organizations that want to follow Kaiser Permanente's lead. And then if either of you could also chime in on how you all might be considering that. Really curious how people in the audience might be able to bring something like that back home.
Thank you, and thanks for that note. It's a really good question, and I think that the first thing I would highlight is it really starts with having leadership engagement and having a culture in which this is a value. And I think there is no better industry than the healthcare industry in terms of being a mission-driven, having mission-driven organizations that are there for their communities. So we're starting at a very good place. And in order to actually leverage that strong foundation to drive change, I think one of the most important things for any leader is really to be multilingual. And what I mean by that is not to be able to speak multiple languages, but to really understand who your stakeholders are and what their value systems and what their drivers are to tap into. So for instance, when working with our physicians and clinicians, the reason why this matters is connecting to why they do this work and how that connects back to climate and health really stems from the first do no harm or the relationship climate has to the health of their patients. When working with our CFO, it really comes down to appreciating and understanding what are the financial implications and understanding and communicating that, going green doesn't always mean spending more money. Wasting less means saving more. When working with our facilities, understanding their operational constraints, how can we build this in? And in layering those conversations with every interaction, we're able to really drive that systemic change where this is not some add-on that's been, driven by a corporate commitment, but something that really is important for the organization. And from that, that's when we start to see success. So, we were the first health system in 2020 to achieve carbon neutrality. And leveraging that platform now in 2022, we committed to reducing our emissions. That carbon neutrality was focused on our scope 1 and scope 2, so a lot of our energy, to now moving beyond that when it comes to our supply chain and our value chain with a 50% reduction by 2030 and net zero by 2050. And there's no way we're going to be able to do that if we continue or if we look at environmental work as something that somebody else is doing or the job of the environmental leader. It is an opportunity to really build it in as every person's job. And that's why being multilingual is so important.
I I love that. I echo everything you say, and I think it's incredible the work that Kaiser has been doing to lead in this space, and Seema, that you as a climate champion, it's just incredible to be on the same stage with. In Blue Shield, I would say, the way that we think about this is very similar. My team sits within our corporate citizenship team, but we have very strong top-down support and relationships from our executives, our board. We co-own sustainability goals with the executives that, for example, lead supply chain work. So our supply chain work is owned by both our team and these executives, and I think that's really been crucial for getting the focus and the advanced kind of movement and commitment. I would say, just in kind of building off of the multilingual course piece that Seema mentioned, it's just really giving people hope in the understanding that this is an all-hands-on-deck issue. We're facing a public health crisis that, we have not seen in recent years, and that it's an urgent issue, and delay is the new form of denial, but everybody has a role. And so there's a lot of conversations that we do internally and with our different stakeholders. Like Seema mentioned, everything from our employees who are very passionate about sustainability and becoming climate champions, and leading conversations kind of up and down our areas of influence. So, even something as simple as having a meeting with admins recently and just talking about we don't need to be ordering plastic bottles. No matter where you sit in the company, you have a role, and you can make decisions that are more sustainable and have an impact. So there's a lot of work that we do both internally and externally around that, just creating that message of hope and action.
And I'll just briefly echo everything that Seema and Bayless just shared. I think no matter where you sit in a healthcare organization, there is a role to play in climate and health, whether on the mitigation side of reducing impact or the adaptation side of trying to help people, help communities, help healthcare systems respond to growing threats of excess heat, of wildfire smoke, of flooding. And I think from the ViVE community, especially because there's a lot of folks that are really involved in the technology side, in the data side, in the informatics side, there is a huge need for all of that infrastructure to be working together. Whether we can think about climate, environmental impacts as a determinant of health, an environmental determinant of health, a climate determinant of health. And we've seen a lot of work in the social determinants of health space of being able to better gather data to connect that to all aspects of care to be able to act on it. And that is the kind of work and just one of the layers that we need from the environmental and climate perspective. So no matter what aspect of the healthcare infrastructure, the innovation infrastructure you're part of, there is a role that you have to play in addressing the climate crisis.
Thank you. Yeah, I really love the emphasis on being multilingual, being able to speak the language from the front line to the bottom line. And just quick shameless plug for CHILL, our newsletter really addresses so many different aspects of this to help you. It's a bi-weekly newsletter, ourclimatehealth.org, if you want to sign up for it to learn more and join these conversations. So let's shift gears a little bit and start to focus on the role of tech in climate health. So we'll start with Chetan. Beyond infrastructure improvements, how have your organizations utilized innovative technology like AI, data analytics, telemedicine to enhance both environmental and behavioral efficiency? And if possible, could you please use specific instances of how the tech has been implemented and the effects at achieving the sustainability goals so that our audience can have more tangible understanding of how it works?
Yeah, so one of the areas that we've been working on through my role as a pediatrician and informatician at Stanford has really been looking at how we can utilize the electronic health record, the EHR, to nudge sustainable care choices across a number of clinical disciplines, from anesthesia to pulmonary medicine and many others. We've identified opportunity areas where you can achieve the same clinical outcome with a lower carbon footprint. And so one specific example is with the prescription of inhalers. some studies show, there's a study out of the NHS in the UK that shows that 3% of the NHS's entire greenhouse gas footprint is the prescription of inhalers for conditions like asthma and COPD. And part of that is because certain inhalers, meter dose inhalers, are really significant greenhouse gases. The good news is that there are alternate inhalers that have a much smaller carbon footprint, but do the same thing clinically. And here, the challenge and opportunity is one of education and nudging behavioral change. Patients and clinicians often aren't aware of the climate impact of the inhalers that they're using, that they're prescribing. And so one of the areas that we're exploring through utilizing the EHR at Stanford is nudging greener inhaler prescription choices. And the EHR connects everyone across the healthcare organization. It connects frontline clinicians to administration, to patients. And so that is one tool that we have in being able to nudge greener changes in care delivery.
Would anyone else like to touch base on any of the innovations within their organization?
You know, I think I would just echo the real opportunity there. I think that there's just a huge gap, and there is so much richness in healthcare data, and to be able to leverage that in a meaningful way is really something we just haven't capitalized on, and the power that that can bring in terms of changing health outcomes, addressing equity issues is something we're only starting to appreciate. So.
I'll also echo this. I think one of the areas that we've been focusing on more is on the risk and resilience side. Is that one way to think about what payers do is we insure against the greatest threat to human health, and so understanding really how, as the climate is destabilized, that impacts our members' health, and how in a world where there are not unlimited resources, we can really target resources to where they're needed most. And so we've been doing a lot of work around trying to leverage the Climate Vulnerability Index and looking at where our members are most at risk, and then using that data to inform how we then address, meet members where they're at and where they're being most affected. So everything from kind of more community-focused efforts in terms of directing environmental justice investments to more targeted approaches at member levels. And so I think that there's incredible opportunity to do more, and increasingly to leverage both in the mitigation and the adaptation sense, leverage data.
If I could just actually add on that spirit, a real life example of some of the work we're doing in this space right now, and that is, as a health system, every 3 years we need to do a community health needs assessment. So taking a step back, I actually report into our chief health officer, and that's because the way we really look at environmental stewardship is the direct connection to health. And as we do those community health needs assessments, we've actually built a tool that looks at some of the environment, the climate and environment risk factors. So things such as risk to flooding, risk related to air quality, risk related to extreme heat, and then map that geographically, as well as layered on equity issues such as percent non-white population, to be able to look community by community to understand what those vulnerabilities mean, to then support those communities with the types of programs that really will address some of those upstream issues. So just a real world application of how we can use tech to really enhance and support the health and equity of our communities.
One just thing I love about what you said is the use of data to understand both the need and really to understand if you're appropriately addressing the need, which I think, again, both fairly exciting opportunities.
I think you all are touched base on a really important part of the panel I wanted to share is the gaps in innovation that are necessary. And in 2020, both Kaiser Permanente and Blue Shield of California reached carbon neutrality and have continued setting ambitious goals, such as Blue Shield aiming to be carbon negative and achieve zero waste operations. So these are initiatives beyond direct patient care. And within the audience, there's various aspects of interaction with healthcare, both directly to the patient and beyond. So maybe if there are some more specific examples beyond the idea of like prediction in general that might be related to the innovations in climate and health. What's missing? What do you need, or what's there that's good but could be better? And including also Jathan, if you could chime in too.
Sure. So I think there's a tremendous amount of opportunity here. I'm trying to think of something I haven't mentioned before, but within, for example, just the realm of telemedicine, I think we learned a tremendous amount during the pandemic. And as we increasingly leverage hybrid and different tools for reaching out to patients and members, I think we're seeing a lot of opportunity to bring care to where folks are at. So we do a lot of work within Blue Shield in terms of health at home and bringing care to people in the community and using a high touch approach. And I think as we pilot and explore these types of innovative forms of outreach, I think there's a lot of opportunity to leverage data to ensure that we're appropriately targeting them and that we're not creating additional equity issues in those efforts. And so I think that's one area of really tying equity to sustainability and to innovation. There's a lot of opportunity. I would say just within our supply chain, I think supply chain data is a challenge in any industry, and in healthcare it's even more complex, and so there's a lot of opportunity in healthcare data, supply chain visibility, transparency, and sustainability, and that's something that we're working on behind the scenes. And I think also including in investments for payers, investments in our holdings are a big area of opportunity to do more from greening perspective, and that's work that we're doing as part of our commitment to science-based targets, but also that we I think requires data, and so a lot of opportunity there.
Happy to add on some great thoughts to some thoughts to those great ideas. I think there are a couple of key things, but I think the first that I'd really like to highlight is helping people connect to the why this work matters. Because I think that once people are motivated and understand the why, the how will come. We are in a conference filled with innovators, and just as a species, we solve for solutions that matter. But until people really understand that climate is a health issue, it's not only about, polar bears. It is about polar bears, but it's also about children dealing with asthma. It's about older adults. It's about strong high heat days. It's about wildfire smoke that impacts us all, and being able to leverage technology in a meaningful way to do that, I think is really powerful. And the other thing I would echo on is your connection there to supply chain. So, in looking at greenhouse gases or emissions, it comes down to a few key things. The first being how we're using energy. And while there's still a lot of work for us to close that gap, we have a roadmap. We know what we need to do. We may or may not be able to fund there to get there, although that is changing as well. The supply chain is an area where there is not a vast roadmap of how do we decarbonize the supply chain? How do we reduce our emissions? How do we also deliver care in a more effective way that has less of an impact on the environment? And, in this room filled with people who understand informatics and technology in a way that I never will, there are solutions that you will be able to see that we will never be able to even fathom. So being able to really look at this challenge through a unique lens is a really great opportunity.
And just building off of these great comments, I think one of the the really interesting thing about climate change is on the mitigation side, it's something that's global. It connects us across the world. But on the adaptation side of understanding what impacts climate change is having on health, there's so much localization that needs to happen, understanding the differential impacts of different climate drivers, whether wildfire smoke or heat or floods or extreme cold or the spread of tick-borne disease. There's so much variability depending on which region you live in. And I think one of the great opportunities we have that we don't harness is being able to connect this into care delivery. I was just this week working in a federally qualified health center in the Bay Area, taking care of children who are in a neighborhood that is impacted by wildfire smoke. And I saw a couple of children who had asthma exacerbations. But when I'm seeing them in my clinic and I'm looking at their information in the electronic health record, I don't see what air quality they were exposed to or what air quality they will be exposed to or what heat risks they have. And so I think that's just at a very specific example, a specific level, we have this huge opportunity and need to bring environmental information into the point of care. And that's just one of the broader ideas from the CHILL and informatics community that we've been talking about and calling a climate health API. And so I think there is a lot of tools that are needed that need to be built. And it's really all because there's so much individual localization and personalization of care that is needed in response to climate drivers.
Oh, good.
I was just gonna say, you triggered another thought for me, which is, Blue Shield has done work trying to invest in just gathering better data or incentivizing gathering more data through, incentivizing Z codes with our value-based care models. And so I think just, again, doubling down on your point, the collection of data from multiple sources, the aggregation of data from multiple sources, that's something we're working on. And creating a longitudinal member-facing digital health record, being able to leverage that and kind of use empowered and targeted resources to communities and speaking to members in also just the ways that they prefer to be spoken to or communicated to is an exciting opportunity. And from the payer perspective, I think as we have data from patients sometimes that may not be connected to, our members may not be connected to health systems, and so this is a way that we can also address populations that may not be getting care in a clinical setting, but reach them through community health or through our doula programs, things like that. So I think there's just, again, tremendous opportunity to collect more data, to aggregate that data, and to leverage it for both understanding the need, understanding the opportunity, and then even understanding where you have effective potential partners in clinicians like yourself. So.
This has been so fascinating, and we've touched on such awesome topics with just this alone. One with supply chain, just a plug-in for the next panel. We'll be talking with Mika Health, focusing on supply chain. For the equity and funding, we'll be wrapping up on those sorts of things. And focusing on equity, and in the audience we have Jamie, who's brought in a lot of great students focusing on digital health equity. And so on that, I want to emphasize that for climate change, communities and underserved communities are the first to be impacted and disproportionately negatively impacted by this. So this question first is for Bayless. How can health insurance companies incentivize healthcare providers to adopt sustainable practices, but ensuring that the transition to decarbonization is equitable and does not negatively impact underserved communities?
I think this is a great question, and I think it's quite frankly, I think it's nascent. I think that there's a lot more work to be done in this area. I think, as payers, as non-integrated payers, we leverage areas where we can incentivize financially, but there's a lot more work that we could be doing to kind of, quote, reach across the aisle to understand and connect with clinicians that want to be advancing practices like this. One thing that we generally do within Health Reimagined and Blue Shield of California is we like to co-design solutions with our stakeholders. And so I think an example of a pilot that we had done a few years ago was around mental health and youth, and co-designing an application with youth in Compton for youth in Compton around mental health. And I think leveraging those types of practices to incentivize, to identify clinicians and to incentivize within our network the ways that we should be transitioning is something that we quite frankly, we need to be doing more in. So I think it's an area that we'll increasingly see work in the future from us on. And also I would toss it to SEMA as an integrated system. I think there's a lot that we can learn from you all and what has worked in your areas.
And I mean, I think you bring up a good point of being able to learn from each other. So, we know that even if Kaiser Permanente, as large as we are, over 200,000 employees, if we got everything perfectly right, it wouldn't make a difference in the big picture. So finding ways in which we work in this pre-competitive space for the good of all is really key in addressing some of these equity issues, some of these bigger systemic issues that impact us all. So, I think there's a lot for us to be able to do together as a healthcare industry.
Yeah, I appreciate it. It is nascent in this, and I appreciate that it's even part of the conversation at the beginning. So we're going to be wrapping up. Before we do, I have two last questions. The first one is, now the next panel is going to dive into policy, venture capital, supply chain, and innovation, which we've covered a bit, but I want to focus in lastly on the topic of funding. So Kaiser Permanente and Blue Shield of California, in many ways, are the customers of climate health tech innovations, but you also find ways of fostering it. So can you elaborate a little bit on what strategies Kaiser and Blue Shield are employing to support or invest in climate health innovation?
It's a great question. So, in terms of the strategies, I think what it really comes down to is looking at where our greatest challenges are. I think coming back to highlight the opportunities of working within the supply chain and identifying opportunities for efficiency there, better opportunities to understand, to truly even understand right now the emissions that are coming from our supply chain is a lot of work and not totally crystal clear. And that's true not only for the healthcare industry, that's actually true for carbon accounting all around. But also, the second part would be really how we infuse this work. I mean, I think Chetan did a great example of making it real, of that patient encounter. We exist to help support our patients and our community and our members. So that is still an area of opportunity for us of how we do that better when it comes to caring for the challenges stemming from climate change for our patients. And I believe that by highlighting where our needs are, that's where innovation will come to us in terms of this is a different way to look at this problem.
Do you have ways of helping fund or grant some of these things?
It's a great question. So, as a nonprofit, especially housed within the Community Health Division, we do make investments into organizations to help solve some of these challenges. So that is an avenue and a path to address some of the community health needs that go towards supporting our communities. Yeah.
We similarly make investments. My team, I think I neglected to mention this, but my team sits within corporate citizenship, so we make investments from essentially an environmental, social, kind of multi-dimensional lens. So if we're looking at partnering or increasing the capacity with an area that we're focused in, it's usually we're going to be looking at it from a triple bottom line perspective. We're going to be looking at ensuring that we're considering things like access, quality, equity, and the financial benefits and things. So I think that. It's
So
generally
to-
our lens.
And so to wrap it up, are there any last words you'd like to leave for the audience with the last couple minutes we have?
You know, I think there's two things that I hope the audience takes away from today's conversation. One is to really just look at climate change in a very different way. You know, instead of really looking at it as something that is happening around us, appreciating that it is something that is happening to us, and then using that as a driver for change. So I know one of your first questions was, what do I do in my role as leading environmental stewardship for Kaiser Permanente? Well, I wouldn't want everybody to have my job for a lot of different reasons. But what I would hope is that everybody goes back to where they sit and leverages their own superpower to drive change from where you are. Every job is a climate job, and the reason to do that job is because it impacts your health, it impacts the health of your community and your family. So those would be the key things I hope people take back from today's conversation.
Echo everything that Seema said, and I just, within the healthcare industry, I think we have tremendous untapped superpowers as a trusted voice on climate and health. And so, you know, again, this is an all hands on deck issue. It's not a polar bears and penguins issue. It's a people issue as well. And, you know, tapping that superpower and going back and figuring out who your allies are that you can empower, inform, and activate is the call to action for everyone here in this room.
Yeah, and just really briefly, echoing the same sentiment, I think climate change is an issue that can feel so large, overwhelming, something that you don't really want to engage with because it's all-encompassing. But actually taking action, even in small steps, even reading about it, you all being here today is a great, important step. And it's through that action that you start to go from climate pessimism to climate optimism. And just wanted to end with a great quote that I heard recently from Dave Chokshi, who was the commissioner for health in New York City during the pandemic. He had this beautiful phrase, which was to sublimate your frustrations into aspirations. So take those things that bother you, that frustrate, that are challenging, and actually turn those into your aspirations. So thank you very much.
Thank you so much. For our panel, please a round of applause for them. Okay. So then we'll just transition over to the second panel now. Thank you.
As everyone's settling down, I just wanted to do a quick poll